Hello, my name is Junchul Park from Yonsei University. Today we have a special guest, Dr. Sabine Roman. She's the professor of the Hospital of LYon. So I'm going to talk about she's lecture and session about it. So hello.
Hello.
So representing the APD community, I sincerely thank you for participating in APDW and replying to this interview. So you must have been very busy with 2 lectures in this year and as a chairperson in APDW 2018. First of all, about your session, the title, Overview of Recent Progress in GI Disease, especially upper GI disease. Could you emphasize some point about your lecture dealing with a diagnosis treatment of GERD?
Okay, so I would like to thank you for your invitation. It's very a pleasure and an honor for me to be here in Korea, and I have to say that it's my first time in Korea, and I really enjoy this time. So it was a great pleasure for me to get this talk on the update of GERD diagnosis and treatment, because I think since the last year we made some progress regarding actually the way that we should consider what is GERD, and especially we made that with an international consensus which is named the LYon consensus.
Yes.
And in this consensus we define which examination should be done for GERD and which are the threshold to define the disease. So it was a huge achievement, because for the first time we really tried to have something maybe quite conservative but at least accepted by everybody. So I think that the aim of this overview was really to make the point that now we have some common basis. And I also try to present the different techniques available for the diagnosis, so the upper GI endoscopy, the reflux monitoring, the mucosal impedance, things like that, which are quite new now, but which are promising. Regarding the treatment, that's quite interesting also, because we still have some very interesting progress since the last year. So even if the PPI are still, the first-line treatment, we have new drugs, the PCAB, which are quite interesting, and maybe more interesting actually in Asia than in other parts of the world, due to some resistance or to some high elimination of PPI in the Asian patients. So that was something very important. We have also new data regarding the indication of fundoplication. And fundoplication is probably interesting in some patients with refractory GERD, as long as you perform a very careful evaluation. And finally, I also tried to have an overview of the new mini-invasive treatments, so either surgical treatments such as the LYNX, the electrical stimulation, or some endoscopic procedure, which most of them actually are coming initially from Asia, which is very well known for new technique in endoscopy. And I think it's a promising area, even if we need probably more evaluation for this technique.
Okay. So I heard a lecture also today. So I'm very interested in the mucosal impedance. So how about your thought about prospectively? Is it going some very large study or something?
So far, I think that the mucosal impedance, it's really a new tool when you use the device which is designed by Diversitech. We already have some data regarding actually the mucosal impedance if you do the measurement with 24-hour pH impedance monitoring. And it seemed that it could be similar, and with this data, it seemed that it could be a yield for the diagnosis of GERD. However, it will require a 24-hour recording. But with this new device, I think the idea is to have a quick diagnosis of GERD. You can do it right away during the endoscopy. You put the probe, you measure the mucosal impedance, and the first studies are coming from US. They are not yet published, they are ongoing.
Okay.
But they are really, really, really promising. They had some data published actually by Mike Vesey a few years ago with a prototype. it was already very good, and now we have a better device. So I think it's very promising tool, and my view of this thing is that we will still perform a per-GI endoscopy for different reasons, and especially for screening of cancer. But when you are done with your screening, you can put right away the probe, and in less than 5 minutes.
Yeah, it's good for patient also
Exactly.
endoscopy. Yeah.
And it takes 5 minutes.
5 minutes, okay.
And it's not as pleasant as having a catheter for 24 hours, or even, having, when you use a wireless system, it could be painful, into your esophagus because you clip something in the esophagus. But here, with a probe, you put the probe, less than 5 minutes.
Yeah, that's great.
You have your diagnosis. So I think it's a really promising tool. And of course, we need more evaluation. But so far, it's probably one of the best innovations we have for the last 10 years, I would say.
Okay, great. So, in this session, we handle that PCAP. So, I think the PCAP is very important, potential PPI, but some concern that long-term outcome of safety. So, what your personal thought of the safety of using PCAP long term?
So that's quite interesting because, you may know, PCAP are not available in Europe.
Not
yet. Okay, Not yet, I would say.
Oh, I see.
So our experience with PCAP came from your countries in Asia, because you are the country with a good development of PCAP. So I think that now it seems that what I heard is that it's pretty safe drugs, and with no real side effect, with very good effect to control acid exposure, but also it seems that it can really help for eradication of Helicobacter pylori. I think that's also a very important thing. So it's new drugs, so of course we have to be careful to follow the patient, but it seems that so far that it could be very good drugs with a very good safety profile, at least with the first studies. So I think it's more than promising. I think it's already out, and I hope that we will have that soon in Europe.
Yeah, okay. So I have a personal question that so I'm an endoscopist, so I'm curious about in the European country, do they, how many percent the girls, every girl undertook endoscopy treatment? So in Korea, there's not many. So I'm asking that I'm an endoscopist. So is there how many percent underwent endoscopy treatment with GERD?
I think very few.
Very few.
The thing is that a few devices were really approved in Europe. And we try to perform some studies, some controlled studies, but so far the gain was not that much compared to PPI. So I don't think these techniques are very popular in Europe for bad reason, I think it may change in the future because more patients now want really to stop their PPI therapy. They want an alternative, and we have new devices which again are quite promising, and I was, for example, very impressed by what Inoue proposed a few years ago when he did the mucosectomy.
Yeah, mucosectomy. Yeah.
And I think it was a very good idea. You have all these devices to create some application. So device improve, and it seems that it becomes better in terms of outcomes. So I think we should try to do more and to see what's going on. So I hope also that we can improve that, and maybe in the future use more this endoscopic treatment. And finally, when you look at the treatment of achalasia, which is a motility disorder, with the POEM is a very good thing for achalasia, but we have to face with GERD in some patients.
Yeah, that's right.
And I think that this endoscopic treatment might be an approach to treat GERD after POEM,
POEM,
which is a problem. So even if achalasia is a very rare disease, I think that for an endoscopist, I think developing treatment, endoscopic treatment of GERD is useful for GERD patient, but it might be also useful for this POEM patient. So I think it's there is work, but I think it could be in the future. It could grow up.
Okay, thank you. So you said this is the first time in Seoul.
Yeah.
So tell us about your impression of APDW in Seoul in this conference.
So I'm very happy to be there, and I realize that Asia and Europe, we have a lot in common.
Yeah.
Because the APDW is a mix of different countries in Asia,
Yeah,
with differences, but these differences are also the richness of the conference. And I think that in Europe, we have the same, actually. And I think it's a very good mix, it's a very good balance, and the quality is quite impressive. And I think we learn a lot from each other, from experience which are different, you know. So I was very happy, and I learned a lot on Helicobacter pylori, for example, the screening for cancer, which is amazing here. The job you are doing is just a high-level job, and I think we have to learn a lot from you regarding this detection.
There's so many breast cancer patients in Korea.
Yeah, but you know, you are doing a very good job with the detection, with the screening program, and I think we have to learn from you, of course.
Okay, thank you for your kind interview. So I'm very happy and very impressed that many foreign doctor gathering in Seoul, so they discuss hot discussion like that. I very enjoyed it. And also, you also enjoyed it, I hope. Okay, thank you very much.
Thank you very much. Thank you.